From team MDSCONQUER. Now we'll be going through the second part of orthodontics, that is the quick retention. So coming to this appliance, it is a bionator appliance which is given by the scientist name, and the thickness of the Y, that is label bow, it is 0.9 millimeters, and palatal bow it is 1.2 millimeters. So important things to be added. And please do make a note about the different types of bionators which are already discussed on the group. That is very, very important. The next comes is a twin block appliance. Most of you are well familiar with this diagram, that is twin block appliance. Basically the angle between the two twin blocks initially is going to be 45 degrees. When it is activated, it's going to convert into 90. For example, if they're asking the question is activated. For example, if they clearly mention what is the initial angle, then you go for 45 degrees. Okay, so it is intermaxillary extraoral traction. Upper and lower bite planes are interlocked at 45 degrees initially, and whenever they are activated, they are going to be 70. Okay, so these are the important points to be added. It is given by Clark. It consisting of a delta clasp. This is a question that is given in the NEET 2020. Okay, and it is less fatigue, decreases the lower anterior proclination. So the next comes is FF. Okay, most of you are familiar with this diagram based question and this with this appliance. Okay, so please do make a note of all these important things about this particular appliance. Okay, so please do. Okay, you have all these diagrams which are clearly given in your power play books. Make a note, just go back, just have a glance of diagrams. Most commonly asked different types of pliers. Okay, so this is the distal and cutter. What are these elastics? Okay, which helps in closing the spaces, correcting the open bites. Please do go with the classification of elastics. What is type 1, class 2, and class 3. Okay, please do make a note about the three classes, which is most commonly asked question and confusing. The next comes, these are separators. So please do make a note. Okay, make a note of this appliance. Okay, so again this is very, very important. Grades. Okay, so grade 5, grade 4, nowadays they're asking questions 3, 2, and 1. Please do learn all these grades. And what is the difference between the slow expansion and the rapid expansion? So please do make a note the values. Okay, so question given is the amount of activation that is required. So this is a question given. So rapid is more dangerous. Okay, so it is less dangerous. Okay, it is relapse is more, relapse is less. Okay, so this is again a question that is given in one of your mock exams. It is a band removing player. This is a question given in the AIMS examination. Of course, this classification is very, very important, and of course one of the confusing. So question asked is type B. What is type B? Type B is prognathic maxilla and orthognathic mandible. You have the same classification in your power play books, so please do make a note. Okay, this is one more classification, that is Bennett classification basing upon the etiology. The class 1 is abnormal position of 1 or 2 molars, and the class 2 is abnormal position of part or whole of the arch, and part 3 is both the arches, either arches and the facial contour. And one more important classification, that is Simon's classification. Most of you are familiar with this. So you have 3 planes, and the disparities in these 3 planes. This is 1 plane, this is 2 plane, this is 3 plane. What happens in the contraction, what happens in the retraction, what happens in the attraction, what happens in the abstraction, protraction, retraction. So please do learn all these terms and terminologies. High chances they can ask questions on this area. The next comes is the Downs analysis. I'm just going to give a brief idea of what's going to happen in Downs analysis and everything. Most of you are familiar with this. We have a good discussions during the flowmetric analysis part, and of course we have videos on the website. You can watch them. So Downs analysis is most frequently used analysis. Okay, so it has 10 parameters in it. Okay, so please do make a note of all these 10 parameters, that is the skeletal and the dental, 5 skeletal and 5 dental. And coming to those things, that is the first one is the facial angle. The second one is the angle of convexity. The third one is the AB plane angle. Fourth one is the mandibular plane angle. Fifth one is the y-axis. The next goes is about your dental parameters, that is cant of occlusal plane, lower incisor to that of the occlusal plane, lower incisor to mandibular plane, interincisal angle, upper incisor to apogonia. Okay, so these are the values that you have to make a note. Okay, so I'm just going to give the average values. So that is 87.8 degrees. The next goes is 0 degrees. It is minus 4.6 degrees. It is 21.9 degrees, 59.4 degrees. So coming to the dental parameters, 9.3, 14.5, 1.4, 135.4 and 27 millimeters. Okay, so what happens if this value is more, what happens if this value is less? So basing upon which we'll be diagnosing the case and basing upon which we'll be planning the treatment. So regularly, I mean, such question, a simple question was given in the NEET examination 2020 and 1920 also. 90, I mean the NEET 19 also. So please do make a note of these values. Go back if you're not very clear about these angles. So what are the two references which are taken to draw this particular angle? This is the normal value. What happens if it is above? What happens if it is below? For example, if this value, like this value is above 87.8 in this facial angle, if it is above, increasing in the facial angle gives an information it is in a class 3, skeletal class 3. If it is below this value, then it is considered as in a class 2, such that you have to learn for all the things, because they're asking directly or indirectly questions over that particular area. The next comes is the one more analysis that is called as a Stenos analysis. So in the Stenos analysis, you have a parameter similarly like that of your Downs analysis. Okay, you have a parameter similarly like that of your Downs analysis, that is your skeletal parameters, dental parameters and your soft tissue parameters. So what are the skeletal parameters? The skeletal parameters in this are, you can make a note about SNA, because this is a question that is given in the NEET. SNA, SNB, A and B. Okay. The next comes is the occlusal plane angle. Then comes is the mandibular plane angle. The next comes the dental parameters. The dental parameters which includes are the upper incisor to NA angle. The next one is upper incisor to NA linear. So this is an angle and this is a linear dimension. Then the lower incisor to NB angle. Then interincisal angle value. Similarly, like you will have interincisal value in the case of your Downs analysis also. Okay, then comes the last one is we are talking about something called as a soft tissue analysis, that is an S line. So these are the parameters that you have to make a note. So I'm just going to give the rough values. This is 82, this is 80. So this is the difference between these two values. SNA minus SNB is called as A and B. Okay, so that is, the minus means it is 2. Then it is 14.5 degrees. It is 32 degrees. Then comes this value. This value is 22 degrees. This dimension is 4 millimeters. This is 25 degrees. And this is 131 degrees. And coming to the word about your soft tissue analysis, I mean, like when the lips are well balanced, and when the patient is like well balanced, and when the patient is making if the patient lips are located beyond this line, when you draw a line, the line that is making contact from the soft tissue contour of the chin to that of the middle surface of the S that is found by the lower border of the nose. Okay, so when you draw a line, if these lips are beyond this line, okay, then you can consider as protrusive, and if these lips, if they are within the line, then they are considered as retrusive. Okay, so that's just an inference. So please do make a note about the reference line which is considered about the positioning of the lips in the case of your S line that is used in the Stenos analysis. Okay, regularly asked question theorems. So please do make a note of all these 10 theorems. They're asking the number. I think 6 was asked in the last year NEET. 7 was asked in the recent INICET examination. Okay, so please do make a note about the 10. The 10th was recently added by the scientist called as Moyes. So they can ask you, what is the theorem which is added by the Moyes to this? Okay, so again, this is a question that is given in your INICET. Okay, what is group 1, group 2, group 3? Group 1 is only lip, group 2 is only palate, group 3 is all of this. They can use like group 1 R means right side, left side, midline. It is involving allolus. Like group 1 A means, group 1 means cleft lip plus allolus. P means partial, submucosal. Again, this is a diagram based question. Hope you remember this diagram based question which we have discussed one of the mock examination. The band which is formed like I mean an extension of band that is formed on the cleft lip area, lip and palate area. Okay, please do make a note of all the classifications of cleft lip and cleft palate, which are easy but may be confused when options are given. Okay, so these are 3 different classifications which are mostly asked in the examination. I'm done for now. Signing off, Dr. Srikanth from Team MDS Conquer.